Health insurers around the country are responding to the pandemic with new steps to help the people they cover, as well as the larger community. This could mean anything from expansion of coverage in connection with COVID-19 to helping essential workers and nonprofits. To tell us about the actions taken by Blue Cross Blue Shield of Massachusetts is its Vice President for Corporate Citizenship and Public Affairs, Jeff Bellows. Thank you very much for being with us, Jeff.
Thank you. I'm happy to be here, Chris.
Jeff, I know we're talking about decisions made by Blue Cross Blue Shield that go back several weeks now, but one thing we notice with your organization and other insurers is that you're trying to lower the barriers to care. Why is that so important right now?
Well, that is one of our main focuses, really been on expanding access for our members, including removing all co-payments, co-insurance, any deductible for all medically necessary COVID-19 testing, supportive care, and treatment. So no family has to worry about getting the care they need during this really difficult time. So that's the number one priority for us.
Because the other thing you're doing is lowering barriers to telemedicine. How has that been working out?
Yeah, so telemedicine has really grown tremendously over time. People maybe don't necessarily need to go see a doctor, or maybe even a little bit afraid to go see a doctor for routine kinds of care. And so telemedicine is, really stepped in and been incredibly, beneficial for everyone. And we're encouraging people to use it. It's just like going to a regular doctor's appointment. And so the rates of telemedicine have really gone up. So it's been really important for us as an option, and important for our members as an option as well, so that they don't have to, not get the care that they need for other things outside of COVID at this time.
Well, with response to COVID, if you're lowering barriers to testing and treatment, I imagine what you're doing is you're helping people deal with it at an earlier point. Isn't that one of the reasons?
Yes, absolutely. We definitely want people to, get the care, at the earliest stage they can, no matter whatever the crisis is that they're dealing with. But certainly, the earlier you can get people a care, the better their outcomes will be.
Well, of course, the response to the pandemic means other things. You're also looking at the larger community. Can you tell me about some of the things you're doing there?
Yeah, so we are doing a lot across the state, thinking about how we can help communities, particularly communities of need during this really difficult time. So the company has committed more than $3 million so far to really help with the COVID-19 relief efforts. And we've done that with different relief funds across the state. In Boston, we are part of the Boston Resiliency Fund, working with Mayor Walsh and the things that he is deeming necessary to help those most vulnerable within our communities. One of the things that is really risen to the top, I think there are probably like three things that have risen to the top, the way that we're really thinking about it. One is around access to food, access to healthy food, really an important issue. So we're funding a lot of organizations and relief efforts around giving people access to food. As more people become unemployed, that even becomes a greater number. So really that's an important issue. The second is around basic needs, making sure that people have access to basic needs across the board. And that it becomes even more important during a health crisis like this. So access to basic need is the second category. And the third is really helping first responders and those on the front line. So we really think about, the healthcare workers, the police, the fire, but also grocery store workers, retail workers, people who are having to go to work during this difficult time and maybe having more exposure to people and potentially the virus itself. So we're trying to think of those kinds of programs and initiatives and putting our support and financial support and other support in that direction.
Now, you mentioned those essential workers, like the people in grocery stores. Does that mean helping them with protective equipment?
Yeah, well, in some cases, yes, we've been doing that. A lot of times what they need is the programs that we're focusing on. They need the funding so that they can go out and buy the protective equipment. But we have donated some protective equipment to Boston Healthcare for the Homeless, for example. With some of the N95 masks, we had some of those, and we donated those to the Boston Healthcare for the Homeless program, for example. Yes, those are definitely things that a lot of our first responders are looking for.
What about the access to food? Because obviously people need that for nutritional reasons, but what about the risk of exposure they might otherwise be running if they had to do other things to get food?
Yeah, so food is a big issue, and we work with a number of organizations across the state, including Project Bread, and they're doing a tremendous amount of work, trying to help young people, school-age kids. When schools get closed, that was one of the biggest issues, in particular in Boston, but in other communities as well. The mayor really, paused on that because he knew that if he closed the schools, a large percentage of the students wouldn't have access to nutritious food, and sometimes that's their only access to nutritious food during the day. So the free breakfast and lunches that they get at school are a big part of their nutritional values that they're getting during the day. So being able to provide that for people, and then again, as more people become are losing their jobs or affected by this crisis in different economical ways, the food access is important. And in normal time, we've learned this from Project Bread. In normal time, about 8 to 9% of the population in Massachusetts is food insecure. And as of last week, Project Bread was finding that 38% of the population in Massachusetts was food insecure. So the numbers are really growing. So having access to that, so working with the Greater Boston Food Bank, other food pantries across the region, and trying to get people that food that they desperately need is really an important component of this, relief effort. And it also is really important for people's health overall. So we want to get people that during this time, but it's a really important thing for us to do across the board.
Of course, it also occurs to me here at this time, a lot of healthcare providers, whether it's primary care or acute care, are financially stressed, even the most prestigious. So doesn't this effort in a way help them too, at least in the longer run?
Absolutely, yes. I think that I think anytime we can help people with access to food, such a critical thing that it helps everyone across the board.
Right. We should say finally, as far as helping with the resiliency fund, you make a big contribution. What about how that ripples out and gets more people to chip in?
Yeah, well, being able to, when you do participate in those kinds of things and you can give it a little bit more exposure, it just, raises the awareness. And I think that that's one important thing that we're trying to do with this hashtag, We Are Mighty Massachusetts. I think that really getting people in the mindset of that they can do, that they can help out too, that all acts are important, big and small are really important. So anything that people can do to help during these difficult times is really important. So I think, shedding a light on that and really trying to spotlight it is something that we're trying to do across the board. So, whether it's promoting, this We Are Mighty Massachusetts, the video itself, getting it on TV, doing it through social media, anything that we can do to continue to promote the great work that our fellow citizens are doing across the state, in the city and across the state, is really important, and hopefully will encourage other people to do those things as well.